Hi friends, we have a construction worker who has presented to our emergency with a case of acute head trauma. He initially reports being hit on the left side of his head, following which he had a loss of consciousness for a brief while and then regained consciousness. Now this is a very important clinical phase that we talk of when we talk of head traumas, that a patient after a significant head trauma loses consciousness only to regain it back. And once he regains the consciousness, he appears to be well. He initially does not want to maybe reach out to help. Often we have cases where the patients don't want to come to the hospital because they feel that everything is well, only to find that just after a few hours, there's a rapid deterioration of his symptoms. There's a progressive headache, there's a worsening headache, there's a drowsiness that is developing with a rapid and a steep decline of consciousness. In this case, we have a very similar feature. Along with it, we also have a left dilated pupil. What are we talking of? This clinical phase is typically called the lucid interval. Whenever we are doing a CT, we are actually finding the criminal. And what is it? It is an extradural hematoma, an EDH, an ideally shaped biconvex hematoma that is developed. Why is this a medical or a surgical emergency? Because, first of all, it is an active bleed. An active bleed, how do we know it's an active bleed? Because it's a opaque lesion. It's a white colored lesion, right? So something that is white on X-ray can either be a bone or can be an acute bleed, an X-ray or NCCT, whatever you call it. So something that is white on CT is either a bone or an active bleed. Now what are we having in this case? We're having an extradural hematoma. Some few pointers that might help you for your future references. What is exactly the point of maximum impact that can lead to an EDH? It is something called the terion, P-T-E-R-I-O-N. It is exactly the point where the anterior division of the middle meningeal artery is present. And any trauma or significant impact to the terion or a fracture of the terion can lead to injury to the anterior division of the middle meningeal artery, which can lead to profuse bleeding and hemorrhage. So what do we do in this patient? It's a neurosurgical emergency. You have to do immediate burr hole to decompress and evacuate the hematoma. That is the answer to this question, my friends. It's a surgical emergency. Be rapid, be quick, do conservative management, the basics, ABC, it's everything that you need to perform, but shift this patient to the neurosurgery OT as soon as possible. Once you evacuate the hematoma, the patient absolutely becomes fine because the brain now starts re-expanding again. The delay that you do, the more delay that you do in evacuating the hematoma, the worse it is for the patient, the higher is the mortality rates. So that's our case. Thank you so much. Lots of love.